June 7, 1944. A makeshift Allied field hospital, 3 miles inland from Omaha Beach. Oberarzt Friedrich Weber pressed himself against the canvas wall of the medical tent, his surgical smock still stained with the blood of German soldiers he'd been treating hours earlier when American forces overran his aid station. Through the tent opening, he watched Allied medics carrying wounded men on stretchers, both American and German, side by side. Weber had spent the past 12 years absorbing Nazi propaganda about Allied savagery, about how the mongrel American army showed no mercy, about how Jewish doctors in their ranks would exact revenge on captured Germans. What happened next would shatter every assumption Weber carried about his enemies. An American medical officer, captain's bars gleaming on his collar, approached with an interpreter. "Doctor," the American said through translation, "we need your help. We have more wounded than we can handle. Will you assist us in surgery?" Weber stood frozen. This wasn't how capture was supposed to work. Where were the beatings, the interrogations, the revenge? Instead, this American officer was asking him, a Nazi military doctor, to work alongside Allied surgeons as an equal. Within 30 minutes, Weber found himself scrubbing in beside Major David Steinberg, a Jewish surgeon from Brooklyn, preparing to operate on a 19-year-old Wehrmacht soldier with a shattered femur. As Steinberg's hands moved with practiced precision, Weber realized he was witnessing something his Nazi training had declared impossible. A Jewish doctor, someone Nazi ideology classified as racially inferior, was demonstrating surgical skill that matched or exceeded the best German surgeons Weber had trained with in Berlin. The contrast between Nazi medical ideology and Allied medical reality would prove more devastating to German doctors than any military defeat. Over the next 11 months, as thousands of German medical personnel fell into Allied hands, they would discover that their enemy practiced medicine according to principles the Third Reich had abandoned. The Hippocratic Oath versus Nazi racial biology, individual patient care versus state-directed elimination, medical ethics versus genocidal complicity, the transformation of German military doctors from Nazi ideologues to witnesses of genuine medical professionalism would become one of World War II's most profound psychological victories. To understand the shock experienced by captured German doctors, one must first grasp how thoroughly the Nazi regime had corrupted German medicine. The profession that had once led the world in medical research and clinical excellence had been systematically perverted into an instrument of genocide. The transformation began almost immediately after Hitler's seizure of power in January 1933. By April of that year, the law for the restoration of the professional civil service expelled Jewish doctors from hospital positions. Within 5 years, 45% of German physicians had joined the Nazi Party, a higher percentage than any other profession. The German medical establishment didn't just accept Nazi ideology, it enthusiastically embraced it. At the 1935 Nuremberg rally, the Nazi Physicians League gathered 3,000 doctors who pledged to become biological soldiers of the Reich. They weren't coerced. They volunteered to transform medicine from healing into a tool of racial purification. The Nuremberg Laws of 1935, which stripped Jews of citizenship and forbade intermarriage, were drafted with extensive input from medical professionals who provided pseudoscientific justification for racial separation. German military doctors operated under principles that violated every tenet of medical ethics. They divided patients into categories of racial and political worth. Aryan soldiers received the best care, extensive surgeries, scarce medications, and lengthy rehabilitation. Slavic prisoners of war received minimal treatment, often dying from treatable wounds due to deliberate neglect. Jewish prisoners received no treatment at all unless they could be used for medical experiments. The T4 euthanasia program, which murdered 70,000 disabled Germans between 1939 and 1941, was administered by doctors. They selected victims, operated the gas chambers disguised as shower rooms, and signed false death certificates claiming natural causes. When the program officially ended due to public pressure, it continued covertly in concentration camps, with medical staff serving as executioners. Oberarzt Weber embodied this corruption. Trained at the prestigious Charité Hospital in Berlin, he had been a promising young surgeon before 1933. After joining the Nazi Party in 1937, his career accelerated. By 1942, he was chief medical officer for a Wehrmacht field hospital on the Eastern Front. He had supervised the differential treatment of wounded prisoners based on their racial classification. He had signed transfer orders sending Jewish patients to their deaths. He had done these things not reluctantly, but with the conviction that he was serving a higher biological imperative. This was the man who now stood beside Major Steinberg in a surgery tent in Normandy, watching a Jewish doctor work to save a German soldier's leg. The Allied medical system that captured German doctors operated on fundamentally different principles. The Geneva Convention of 1929 established clear rules for treatment of wounded prisoners of war, and Allied forces adhered to these standards rigorously. All wounded received treatment based solely on medical priority, regardless of nationality or military status. Medical facilities would care for enemy wounded using the same standards applied to their own forces. Captured medical personnel would be allowed to continue treating their own wounded under Allied supervision. These weren't abstract principles, but operational realities, enforced through military discipline. The scope of Allied medical operations in Europe exceeded anything German doctors had imagined possible. By June 1944, the United States Army Medical Department had trained 50,000 doctors, 600,000 nurses and medics, and established a supply system that delivered everything from penicillin to blood plasma across thousands of miles. The Americans brought innovations German medicine had never achieved: whole blood refrigeration and transport systems that saved thousands from shock, penicillin mass production that prevented infection deaths, surgical techniques developed in civilian trauma centers and rapidly deployed to battlefield hospitals, mobile surgical hospitals that could set up within hours and perform major operations under combat conditions. The contrast struck German medical prisoners immediately. Stabsarzt Hans Müller, captured at St. Lo in July 1944, recorded his first impressions in a diary later discovered by historians. The Americans waste medical supplies with abandon that horrifies German doctors trained under scarcity. They use penicillin on minor infections. They discard bandages after single use. They perform blood transfusions on enemy prisoners as routinely as on their own soldiers. Yet this waste reflects not inefficiency, but abundance so vast that conservation becomes irrelevant. They have achieved what we only propagandized. They have created a medical system that can treat every wounded soldier regardless of resource constraints. The penicillin revelation particularly stunned German medical officers. This antibiotic, discovered by British scientist Alexander Fleming in 1928, had been impossible for Germany to mass produce. Nazi chemists had tried and failed to replicate British and American manufacturing processes. By 1944, German military medicine still relied primarily on sulfur drugs that were far less effective and often toxic. Allied forces, meanwhile, had access to virtually unlimited penicillin. American factories produced 2.3 million doses per month by mid-1944, enough to treat every wounded Allied soldier and still have surplus for civilian populations and even enemy prisoners. The differential in medical supply extended to every category. Blood plasma availability demonstrated the gap most starkly. The American Red Cross operated a system that collected, processed, and distributed blood products on an industrial scale. By 1945, 13 million Americans had donated blood, producing enough plasma to treat battlefield wounds across 2 theaters of war. Germany had no comparable system. German soldiers often died from shock and blood loss that would have been easily treatable with plasma transfusions the Americans performed routinely. Major Steinberg's treatment of Weber's patient that first day in Normandy followed protocols that seemed extravagant to the German doctor. The American used penicillin prophylactically to prevent infection. He performed a complex internal fixation using metal plates and screws that German field hospitals rarely had available. He arranged for whole blood transfusion from American donors. He spent 3 hours on a single soldier's surgery when German military doctrine emphasized speed over thoroughness. When the operation concluded successfully, Steinberg turned to Weber and said through an interpreter, "Your patient will likely walk again. In Germany, maybe he would have lost the leg. Here, we tried to save it." Over the following weeks, as more German medical personnel fell into Allied hands, patterns emerged that challenged every Nazi assumption. At a prisoner processing center in England, Oberfeldarzt Joachim Meyer encountered something his training had declared impossible: female doctors and nurses supervising male prisoners with absolute authority. Under Nazi ideology, women belonged in domestic roles, not positions of medical command. Yet here was Lieutenant Colonel Janet Crawford, Chief Surgical Officer, making life and death decisions that German male doctors were obligated to follow. The presence of African American medical personnel created even deeper cognitive dissonance. Nazi racial theory classified blacks as barely above apes, incapable of mastering complex skills. Yet captured German doctors watched African American surgeons, anesthesiologists, and surgical nurses performing at levels that matched white medical officers. At a field hospital near Bastogne during the Battle of the Bulge, Oberarzt Friedrich Klein worked under the supervision of Captain Charles Drew's protégé, a black surgeon who had pioneered blood plasma preservation techniques. Klein later testified that this experience destroyed his racial assumptions more completely than any propaganda could have rebuilt them. The treatment of Jewish doctors in Allied medical services particularly challenged German prisoners. Weber had been taught that Jewish physicians were incompetent, that their medical degrees represented racial infiltration rather than genuine skill. Yet in Allied hospitals, Jewish doctors held positions of authority and demonstrated excellence that Nazi ideology couldn't explain. Major Steinberg, who supervised Weber's work throughout June and July 1944, possessed a medical background that exceeded Weber's own. Graduated top of his class from Columbia Medical School, trained in advanced trauma surgery, published research on battlefield wound treatment. When Weber finally acknowledged this to himself, it forced a reckoning with everything he had believed. The ethical dimension proved most devastating to German doctors' Nazi worldview. Allied medical officers consistently placed patient welfare above political or military considerations. When a German prisoner required a complicated surgery, Allied surgeons performed it with the same care they would provide to Allied casualties. When scarce blood supplies ran low, Allied medical officers allocated them based on medical need, not nationality. When German doctors expressed amazement at this impartiality, Allied medical officers responded with a phrase that appeared repeatedly in German prisoner testimonies. "We're doctors first. The Hippocratic Oath doesn't have exceptions for enemies." This ethical consistency operated at every level of Allied medical care. At the 45th General Hospital in France, Stabsarzt Ernst Hoffmann observed American nurses caring for German amputees with the same compassion they showed American patients. They changed dressings, administered pain medication, provided emotional support, and advocated for their German patients' needs with the same vigor they showed for Allied soldiers. Hoffmann recorded his thoughts in a letter to his wife that was intercepted by censors and preserved in military archives. "These nurses treat our soldiers as human beings deserving of dignity and care. We were taught they were subhuman monsters. we were lied to about everything. The transformation of German medical prisoners from Nazi ideologues to witnesses of genuine medical ethics followed a consistent pattern documented in psychological assessments conducted by Allied intelligence. The first stage involved shock and confusion as captured doctors encountered treatment that contradicted their expectations. The second stage brought attempts to rationalize the contradiction, claiming that Allied medical professionalism represented propaganda or isolated incidents. The third stage arrived when accumulated evidence made denial impossible. The final stage involved what interrogators called ideological collapse, as German doctors acknowledged that Nazi medical ideology was not just wrong, but evil. Not every German medical prisoner underwent this transformation. Some maintained Nazi convictions despite overwhelming evidence. But Allied intelligence estimated that approximately 60% of captured German medical personnel experienced significant ideological change during captivity. The percentage was higher among doctors than among Wehrmacht combat soldiers, possibly because medical training provided a professional framework that existed before and outside Nazi ideology. The post-war reckoning with German medical crimes would reveal how thoroughly the profession had been corrupted. At the Nuremberg doctors' trial beginning in December 1946, 23 German doctors and administrators faced charges of crimes against humanity. The evidence presented detailed medical experiments on concentration camp prisoners, participation in the T4 euthanasia program, and systematic violations of every principle of medical ethics. 16 defendants were convicted, 7 sentenced to death. But beyond individual guilt, the trial exposed how an entire medical system had abandoned healing for genocide. The story of captured Nazi surgeons, stunned by Allied treatment, represents more than individual redemption narratives. It demonstrates how professional ethics, consistently practiced, can challenge and defeat totalitarian ideology. The Allied medical personnel who treated German prisoners as equals weren't executing a propaganda strategy. They were simply following the principles of their profession. That simple consistency proved more powerful than any argument in exposing Nazi ideology's bankruptcy.